Hello, I'm Dr. Jamie Green. I'm a GP partner here at Eleanor Healthcare, and we work across Delapre Medical Centre and Whitefield Surgery. During these exceptional times, the surgeries have remained open to provide you with the care that you need. Many of you may have been touched by the coronavirus, and sadly, many of our patients have become infected during this time. Most of these, however, are now recovering or have recovered, but sadly, a few patients haven't fared so well. We want to update you on how the service is running during these exceptional circumstances. And first of all, I'd like to thank all the patients and staff who've kept us running during this time. Over the next few weeks, I think we're moving from an emphasis of focusing purely on urgent care to trying to reintroduce some routine care. It's important that all of those who need an urgent appointment get an appointment, but it's also very important that routine care is continued, as that includes preventative care. If, however, you do need an appointment on the day, this is done at the surgery through Doctor Link. With Doctor Link on the app or on the website, you can check your symptoms 24 hours a day, 7 days a week, and when you need a consultation, follow the instructions on the screen, and the urgent care team will deal with getting you an appointment at the next available opportunity. You may also wish to look at Eleanor Healthcare's website. This includes information about opening hours, requesting a sick note, writing messages to the surgery, and much, much more. You can even register for online services via the site. And if you have online services, you can access ordering of medications, reviewing your test results, and looking at a summary of your medical record. We've had to adapt the surgery to avoid person-to-person contact, so it's important that you only come to the surgery if you've been asked to do so. Otherwise, you can contact us online or on the phone. If you have an appointment, this will be a telephone call initially, and the clinical team will arrange for a video consultation, if this is possible, and you have a mobile phone with a camera. This is especially good for things like looking at rashes or lumps or bumps. We still need to see patients face to face, and where this happens, an appointment will be made for you. We're looking at new ways of delivering service, and as much of this as possible is being done on the phone, but if you need to come in, we'll ask that you remain outside the surgery until your appointment time. You'll be then kept apart from patients and be seen by a member of the clinical staff who'll be wearing appropriate protective clothing or PPE, and this will continue until further notice or when the pandemic has calmed down. It's also important to note that the surgery has seen a sharp decline in the number of patients appearing for cancer-related symptoms. Northamptonshire as a whole has also seen a sharp decline in the number of cancer referrals. It is vital that people who have symptoms that could represent more severe conditions are seen in the surgery as soon as possible. When cancer referrals are delayed, this can reduce the chances of being cured, and it can increase the number of complications which arise from this. This includes things like heart attacks and strokes as well. If you feel you have symptoms of coronavirus and you are suffering minor symptoms, you should first have a look at NHS 111 online for advice, but also to get yourself an isolation note. If you have children or a baby who has coronavirus, then check NHS 111, but do not delay your care for this child or infant. And if you feel the kid is seriously unwell, call 999. Do not delay getting help. If you're worried, trust your instincts. Parental instincts are incredibly important in looking after children. If you have any of the more worrying symptoms of coronavirus, as listed on the screen, you will need to call 999 for an ambulance. Do not delay calling 999 because the longer you leave it, the lower your chances of survival in more severe conditions. We'd like to thank you again for all of your support during this time. And should you need any more support, the surgery will be happy to be contacted, particularly via our website, where you can request for one of us to get back to you. And stay safe during this time. Bye-bye.